Before I start, let's be clear about one thing. Amlodipine is not a dangerous medication in itself. It is widely used, well studied, and for many seniors, it prevents strokes and heart attacks. But here's what most people are never told in a simple, honest way. The difference between it works and it works well for your body can be huge. And that gap is where most of the confusion, side effects, and frustration come from. Now, let's talk about what you were really not told in that prescription moment. Most patients remember the same experience. A consultation that lasted a few minutes. A blood pressure reading written on a chart. 2 words, high blood pressure. Then a prescription. Amlodipine once a day. That's it. No long explanation. No discussion about what changes inside your blood vessels. No warning about how your body might respond differently at 60, 70, or 80 compared to someone younger. Just a simple instruction that sounds final. Take this and come back in a few months. And many people walk out believing something very important, that the medication is fixing the problem. But the truth is more precise and more important to understand. Amlodipine does not erase high blood pressure. It changes how your blood vessels behave while the underlying conditions are still there. That distinction is the key to everything that follows. And once you understand it, you stop seeing blood pressure as just a number and start seeing it as a system inside your body that can be influenced in multiple directions at the same time. This is Dr. Ricard Ben, a cardiologist with 32 years of experience, and I want to walk you through something most seniors are never shown clearly. What amlodipine is actually doing inside your arteries, why it works so well for some people but feels different in others, and what simple natural factors can quietly improve or worsen its effect. Not to make you fearful, but to make you informed, because informed patients don't just take medication, they respond better to it. Most people think high blood pressure means my heart is working too hard. That is only partially true. The deeper issue usually sits in the artery walls themselves. Your arteries are not rigid pipes. They are flexible tubes surrounded by smooth muscle, and that muscle constantly adjusts tension based on signals your body sends. When you are younger, this system is smooth. Vessels relax when they should, tighten when needed, adapt quickly to pressure changes. But with age, 3 things slowly change. The vessel walls become stiffer. The muscle tone stays slightly on more often. Calcium signaling becomes more active than it should be. That last one is where amlodipine becomes important. Inside your artery walls, muscle contraction depends on one key element, calcium entering the muscle cells. When calcium flows in, the muscle tightens, the artery narrows, blood pressure rises. When calcium entry is reduced, the muscle relaxes, the artery widens, pressure falls. Amlodipine works by blocking specific calcium channels in these smooth muscle cells. Think of it like gently reducing the entry gates for calcium. Less calcium inside the vessel wall, less tightening, lower resistance, lower blood pressure. Simple mechanism, powerful effect. But here's what matters more. It does not remove the reason those vessels became tight in the first place. It manages the output of the system, not always the input. This is something I've seen repeatedly in clinical practice. 2 patients, same age range, same medication, very different experiences. One feels fine, another feels ankle swelling, mild fatigue, dizziness when standing too fast. Why? Because amlodipine changes where pressure goes in the body, not just how much exists. When arteries relax, more blood reaches smaller vessels in the legs. Fluid can shift into surrounding tissue. Ankles may swell slightly in some individuals. This is not kidney failure. It is not heart damage. It is a redistribution effect. But if you don't understand that mechanism, it becomes alarming. An alarm leads to stopping medication unnecessarily, which is where real risk begins. Something very important happens after the first prescription. Many people see improvement in their blood pressure readings and assume the problem is solved. So slowly, diet becomes less strict. Activity drops slightly. Salt intake increases without noticing. Weight creeps up again, but the medication is still doing all the work. This creates a hidden imbalance. The body is still producing the same vascular pressure signals, but now they are being masked by the drug. Over time, the dose may need adjustment, not because the medication failed, but because the underlying system changed again. This is why follow-up matters more than the first prescription. There is one thing many seniors underestimate: sodium and fluid balance. Amlodipine works best when vascular pressure is not constantly being pushed upward by excess fluid retention. In simple terms, high sodium intake equals more pressure inside vessels. Amlodipine equals relaxation of vessel walls. Both together determine your final blood pressure reading. If sodium stays high, the medication has to work harder. If sodium decreases, the same dose becomes more effective. This is why 2 people on identical medication can have completely different results. Not because the drug is different, because the internal environment is different. In the first 1-2 weeks of starting Amlodipine, the body is still adjusting. That is when you may notice slight flushing, mild dizziness, variability in readings. This does not mean the medication is failing. It means your vascular system is recalibrating to a new baseline of tone. Most of these effects settle as the body adapts, but many people panic during this phase and stop too early, which prevents the medication from ever reaching its full stable effect. Here is something I want you to understand clearly. The best outcomes are never medication alone. They are medication plus environment. Amlodipine handles calcium-driven vessel contraction, baseline pressure reduction, but your lifestyle influences vessel stiffness, fluid balance, inflammation levels, daily pressure swings. When both are aligned, results are stable. When they are not, doses tend to increase over time. Not because the body is getting worse quickly, but because the system is fighting itself in two directions. A question I want you to reflect on. Before your next blood pressure reading, ask yourself this. Have I been measuring my health accurately or just reacting to numbers without understanding what influences them? Because the number on the screen is not the full story. It is the final result of multiple systems inside your body interacting at once. After 32 years in cardiology, I can tell you something very clearly. Most confusion around amlodipine does not come from the medication itself. It comes from not understanding what it is actually doing inside the body and what it is not doing. Amlodipine can be extremely effective when used correctly, but it works best in patients who understand one simple truth. It manages pressure. It does not erase the system producing that pressure. That is why follow-up, lifestyle awareness, and consistency matter just as much as the prescription itself. And if this helped you understand your medication a little better, I want you to do two things. Leave a comment and tell me, have you started amlodipine recently? Yes or no? And second, subscribe, because I break down complex medical topics like this into clear, practical explanations that actually help you understand what is happening inside your body. Not confusion, not fear, just clarity. This is Dr. Richard Ben,